It's important to realize that this area within the body of the uterus is called the endometrium. Most cancers of the uterus are, in fact, cancers of that lining. That lining overgrows in response to estrogen. The major symptom that comes out of that overgrowth of those cancer cells is bleeding. So when you look at the concept of, is there any test that we can do to predict cancer early or in a pre-cancer state? Is there a screening test like a mammogram for breast cancer, like a pap smear for cervical cancer, like a colonoscopy for colon cancer? The answer is there is no test. But the reason is because bleeding is the first sign of abnormalities within the uterine cavity. So when women are older than 35 and they have abnormal bleeding or menstrual cycles, menstrual bleeding, it is important to go see a gynecologist in order to sample and biopsy that lining so that you can rule out cancer. Postmenopausal bleeding, after menopause, a woman should not have bleeding vaginally. There should be no bleeding coming from the uterus. The ovaries are shut down, so any bleeding in the postmenopausal state has to do with either polyps, fibroids, precancer changes within the uterus, or cancer.